Quant.com and Dr. Lizabeth Fiedler. She is an expert in the field of the digestive system. She's a gastroenterologist. Today we're going to talk about a screening for colon cancer, which is a colonoscopy, and why that might be important for people over the age of 50. Can you tell us a little bit about who should go to get a screening and what kind of things they might expect?
Well, anyone at age 50 without a history of colon cancer in their family should begin to have their screening colonoscopies. If a person has a relative who has had colon cancer, then you want to start that earlier. You want to start at age 40, possibly even earlier, depending upon how old that person was. You can go and speak to your primary physician about it, and the primary physician can set you up with a particular name with a gastroenterologist, or you can find that gastroenterologist and meet with him or her, discuss the procedure in detail, get scheduled, and in a few weeks from then you'll take your prep, which is a special drink that cleans you out so that the polyps inside can be found and removed, and we can prevent you from developing colon cancer, which is unfortunately a fatal disease in some situations.
Thanks. I know a little bit more about what we do to get ready for that. I wonder if you could tell me a little bit about what factors might elevate my risk of getting colon cancer in the first place. Is there hereditary things or diet aspects that go into that?
Sure. Well, one of the most recognized ones is the family history, which we just mentioned. There are other various things such as obesity, smoking, a diet high in red meat and processed meats, perhaps a diet that's too low in fresh fruits and vegetables. Alcohol is another recognized risk, and even our race can influence our risk. Actually, in African Americans, the age at which they should start their screening colonoscopies is 45 as opposed to 50.
I heard that there's another kind of test called a DNA stool test. Can you tell me a little bit about that and what to expect?
Okay, well, that's a screening test that is done on the actual stool. We used to use a test that checked for blood, and this combines that whole idea with another test that can actually detect the genetic material, which is the DNA, and it can find cancers, and it can find advanced polyps. So those are the advanced growth that, if you will, are about to become colon cancer shortly from that moment. That test, if it's positive, is approved by our FDA. It can be done on stool. It was approved by the Food and Drug Administration to screen for colon cancer, to do a test on the stool, which combines an old test that used to check for just blood with the ability to also find DNA changes in the genetic material that cancers and advanced polyps, advanced growths that are about to become a colon cancer, can be detected. And if a person has a positive Cologuard test, then they should have a colonoscopy fairly soon.
If someone were to get a colonoscopy, how soon after the procedure would they be able to return to work or their regular activities?
The day of the colonoscopy, obviously you're there having your test and you're waking up and you're recovering, but the next day, a patient should be 100% fine, able to do all of their normal activities, including be productive at work.
Thank you, Dr. Fiedler, for being with us today on Mymediclique.com. We've been talking about colon cancer, and I've learned a lot about the screening test, the colonoscopy, and the most important thing is to know your family's history. Check in with people that are in your family, make sure that they're getting their colonoscopies, and join us again next time on Mymediclique.com.